All right, hello and welcome to the PT edition of Virtual Journeys and Destinations. My name is Amanda Frakes and I'll be your host as we kind of talk through all things PT. So let's get started here. So starting off with just a little bit about me, I'm a third-year doctor of physical therapy student at the University of Kansas Medical Center. I'm currently on my first clinical rotation with Excelicare Physical Therapy in Garden City, Kansas. I received my Bachelor of Science in Athletic Training from Kansas State University in 2018, and I'm currently a board-certified athletic trainer. And I'm also a Kansas native, so I was born and raised in Manhattan, Kansas, but I actually really love the mountains. So this picture here on the far right is from my most recent trip to Colorado to hike the Manitou Incline in Colorado Springs. All right, so a quick overview of what we're going to be talking a little about today. We'll talk about PT careers and kind of what those look like. We'll discuss the PT education and admissions process. We'll talk a little bit about whether or not PT is a career that you think is right for you. I'll provide a few additional resources. We'll take a virtual tour of Excelicare Physical Therapy, which, as I said, is the PT clinic that I am currently at for my rotation. And then we'll go through a few skills and techniques that PTs might use on a day-to-day basis when treating patients. All right, so starting off with physical therapist careers. So what are PTs? PTs are movement experts. And what that means is that we are healthcare professionals who diagnose and treat individuals of all ages with medical problems or other health-related conditions that limit their abilities to move and perform functional activities in their daily lives. So the role of physical therapists in healthcare, PTs diagnose and manage movement dysfunction and enhance physical and functional abilities. So we work to restore, maintain, and promote optimal physical function, wellness and fitness, and quality of life as it relates to movement and health. PTs work to prevent the onset, symptoms, and progression of impairments, functional limitations, and disabilities that may result from diseases, disorders, conditions, or injuries. So where do physical therapists typically work? You can find PTs in acute care, and acute care is a setting where physical therapy is provided to individuals who are admitted to a hospital for short-term patient care for reasons such as illness, surgery, accident, or recovery from a trauma. You can find PTs in extended care facilities, also called nursing homes or skilled nursing facilities. In these settings, physical therapy is provided to individuals who are admitted to a facility that typically cares for elderly patients and provides long-term nursing care, rehab, and other services. PTs also work in home health. In this setting, physical therapy is provided in the patient's place of residence. PTs may work in hospice settings. PTs care for individuals in their last phases of life from incurable diseases so that they may maintain functional abilities for as long as possible. PTs also work in industrial workplace or other occupational environments. In these settings, physical therapy is provided to individuals primarily to help them return to work or for the purpose of enhancing employee health, improving safety, and increasing productivity in the workplace. PTs may work for local, state, and federal governments. In these settings, typically physical therapy is provided to civilians or military personnel, and PTs are employed by federal agencies, including the Veterans Health Administration, the Department of Defense, and the Indian Health Service. PTs might work in outpatient or private practice physical therapy clinics, which is what Excelicare is. In these settings, individuals visit the physical therapist in the clinic, office, or other healthcare facility, primarily to address musculoskeletal and neuromuscular injuries and impairments. PTs can work in rehab hospitals. In these settings, physical therapy is provided to individuals who are admitted to a facility or a rehab unit. You can find PTs in research centers. In these settings, PTs and other professionals conduct research to improve patient care outcomes and support the body of knowledge in the field of physical therapy. You can find PTs in schools, be that preschool, elementary school, or even secondary education, such as middle school and high school. And then you can also find PTs in wellness, prevention, sports, and fitness centers. And in these settings, the primary role of physical therapists is to provide care to individuals with a focus on wellness. All right, a few examples of the conditions that a physical therapist might treat. This is not an all-inclusive list. It's just a handful of some of the conditions that we may encounter. So arthritis, back pain, balance deficits. PTs can treat burns and other wounds. We may treat carpal tunnel syndrome, developmental delays in children, chronic obstructive pulmonary disease, dislocations and fractures, hand injuries, headaches, urinary or bowel incontinence, lymphedema, osteoporosis, pelvic pain, sports injuries such as ACL tears or ankle sprains, and then stroke and traumatic brain injury as well. Some of the core values of physical therapists. Physical therapists value accountability, which is the active acceptance of the responsibility for the diverse roles, obligations, and actions of the physical therapist, including self-regulation and other behaviors that positively influence patient outcomes. Altruism, which is defined as placing the needs of the patient ahead of the physical therapist's own needs and self-interest. Compassion, which is the desire to identify with or sense something of another's experience. Caring, which is the concern, empathy, and consideration of the needs and values of others. PTs value excellence, which is consistently using current knowledge and theory while understanding personal limitations, integrating judgment and the patient perspective, embracing advancement, challenging mediocrity, and working towards development of new knowledge within the profession. PTs value integrity, which is the adherence to high ethical principles or professional standards, such as truthfulness, fairness, doing what you say you will do, and speaking forth about why you do the things that you do. We value professional duty, which is the commitment to providing effective physical therapy services to individuals, to serving the profession, and to positively influencing the health of society. And last but not least, physical therapists value social responsibility. This is the promotion of mutual trust between the profession and the larger public that necessitates responding to societal needs for health and wellness. Some of the benefits of a physical therapist career: you get to make a difference. Being a physical therapist is very rewarding. You get to work with patients one-on-one, you get to see them progress through treatment, and you get to know that you are really making a difference in their lives, which is pretty darn cool. You get to be a movement expert. Physical therapists are highly educated individuals and experts in the movement and function of the human body. The goal of physical therapists is to promote the patient's ability to move, reduce their pain, restore their function, and prevent any future disability. You get to enjoy job security. With the aging baby boomer population in America, baby boomers in particular are more vulnerable to chronic and debilitating conditions that require physical therapy services. You get to love your job. Helping people to attain or regain the ability to walk or carry out their daily functions in life can lead to a great feeling of personal satisfaction. And in fact, physical therapists report one of the highest job satisfaction levels in the country, which is pretty awesome. Additionally, if you choose to, you can be an entrepreneur. Many PTs go on to own their own clinics, usually after a couple years of practicing as a physical therapist. So if that's something that interests you, that's an opportunity that you could explore as a PT. All right, moving on to physical therapist education. So the physical therapist degree is a doctorate degree. It's called a Doctor of Physical Therapy or DPT degree. So to practice as a physical therapist in the United States, you have to earn a DPT degree from a program accredited by the Commission on Accreditation in Physical Therapy Education, or CAPTE, and you also have to pass a state licensure exam upon completion of your program. So a little on PT education, kind of what it looks like. The length of most programs is about 3 years, and you complete these 3 years following 3 to 4 years of an undergraduate study or degree. So generally, you're looking at about 7 years of education total after you graduate from high school. You spend about 80% of your program in the classroom and with lab experiences, and then the remaining 20% of the program is spent on your clinical education experiences. Your final clinical experience, the average is about 27.5 weeks. Some of the primary content areas in PT, this is not an all-inclusive list, but areas that it might include are biology and anatomy, cellular histology, physiology, exercise physiology, biomechanics, kinesiology, etc., etc. All right, specialty certification in PT. Physical therapists can specialize in the following areas: cardiovascular and pulmonary PT, clinical electrophysiology, geriatrics or working with older individuals, neurology, orthopedics, pediatrics or working with children, sports physical therapy, and even women's health. Physical therapists often choose to specialize to develop a greater depth and breadth of knowledge and skills related to a particular area of practice. Specialty certification is a completely voluntary experience, so it's not something that you have to do. And physical therapists are not required to be certified in order to practice in a certain area. Moving on to the admissions process. So, ways to prepare to apply for admission to a DPT program. You can research DPT programs and requirements, probably at a minimum 2 years before you begin to apply. Seeking help from your college pre-PT or health professions advisor is also a helpful way to prepare. Completing course prerequisites, which we'll talk a little bit more about. Gaining and tracking PT observation experiences, a minimum of 1 to 3 years in advance. Taking the GRE, which is the Graduate Records Examination, at least 6 weeks before the deadline if it's required by the institution you're applying to. Requesting references from the appropriate individuals, again, if this is something that's required by the institution that you're applying to. And then being sure to apply early. Some programs use rolling admissions or fill classes before the deadline of the application, so that's just something to keep in mind when applying. All right, what is PTCAS? So PTCAS is the Physical Therapist Centralized Application Service. So it's kind of what it sounds like. It's just a centralized application service that you'll use to apply to all the PT programs that you're interested in. So again, this program allows applicants to use one application and set of materials to apply to multiple DPT programs. It's a service that is provided by the APTA, and it's managed by Liaison International. And roughly 80% of DPT programs do participate in PTCAS, so definitely the vast majority. All right, some of the most common college course prerequisites. Course prerequisites will vary significantly across DPT programs, so some programs may include all of these, some may only include a few, some may include ones that aren't listed here. It'll just kind of depend. But you can get more information from the PTCAS website. So a few of these: anatomy and physiology 1 and 2, biology 1 and 2, advanced biology, chemistry 1 and 2, physics 1 and 2, psychology, an advanced psychology course, statistics, and English composition are some of the more common ones. All right, some of the more common college majors for PT students. You're not required to select a particular major in order to be eligible for admission to a PT education program. However, some programs do make it a little easier to get your course prerequisites for PT school, so that is just something to keep in mind. So as you can see, some of the top ones that students do choose are exercise science, biology, kinesiology, health science, and psychology, just to name a few here at the top. All right, grade point average. So many DPT programs do have a minimum GPA requirement, and applicants who only meet the minimum GPA may not be considered competitive. So it is important to keep your grade point average up while you're in college. And listed here are some of the average GPAs for accredited PTCAS applicants in 2013. All right, PT observation experience. So PT observation requirements will vary by program. And basically what these are is getting in with a physical therapist at a local clinic or a hospital and spending the day with them and kind of getting to see what they do on a day-to-day basis. So most programs will require roughly 50 hours, but this can range from 0 to 200, kind of depending on the program. More than one setting may be required. So again, you may need some hours in an outpatient clinic, you may need some at a hospital. It'll just kind of vary by program. It's important to determine if these hours need to be verified by a licensed physical therapist. So do be sure and keep track of your hours and contact information for the physical therapist that you observed. And then it's a good idea to start searching for these experiences at a minimum 1 to 3 years before you do apply to physical therapy school. All right, the Graduate Record Examination, or GRE. Most PT programs do require that applicants take this test. Programs may set a minimum score and last acceptable test dates for this exam. So this is just something to keep on your radar, again, as part of the application process. All right, references. These are also known as letters of recommendation or evaluations. Again, reference requirements, kind of like observation hours, will vary depending on the institution. Most DPT programs do require 2 to 3 references. And these references are often required from a physical therapist. And this is usually a physical therapist that you've spent several hours observing, or one that you've worked closely with, maybe as like a PT tech. And then programs do generally require a reference letter from a professor in your major, or one from a science professor at your college that you've taken a class under. Other factors to consider in the admissions process: interviews. Some programs have interviews and some do not. It just kind of depends. The format may vary. Applicants may be required to speak with a single faculty member, a student, a physical therapist, or a panel of interviewers, or participate in an orientation program. So again, just something to consider when you're applying. State residency. Some PT education programs do give preferences to in-state or resident students. Out-of-state and foreign applicants may have to vie for a limited number of positions, or may be ineligible for admission, depending on the institution and state policies. Extracurricular activities. PT education programs may consider these in the admissions process, particularly those that involve leadership, community service, or have a healthcare component. So do keep track of your activities and honors, particularly those completed during your college education. Work experience. PT education programs may take into consideration your work experience and any family obligations during the admission process. This information may be particularly important for individuals who balance work and home responsibilities in addition to academic course load. And then last but not least, diversity. So PT education programs generally like to have diverse student populations. Some of these factors may include race, ethnicity, economic status, gender, age, geographic location, academic background, sexual orientation, and others. All right, finishing up this PowerPoint presentation with some reflections and resources. So, is physical therapy a career that's right for you? Some questions here to take into consideration. Are you interested in how the human body works and moves? Do you want to interact directly with patients? Are you interested in a hands-on career? Are you an effective communicator? Do you have good interpersonal skills? Can you motivate people? And do you excel in the sciences? If you answered yes to several or even all of these questions, physical therapy may be a career that's right for you. All right, and then looking at a few additional resources here to finish up. The American Physical Therapy Association, which is the national organization for the profession of physical therapy. Physical Therapist Centralized Application Service, or PTCAS, which we've talked about, and is the central application service for DPT programs. The Commission on Accreditation of Physical Therapy Education, or CAPTE, which is the organization responsible for accreditation of DPT education programs. The Federation of State Boards of Physical Therapy, or FSBPT, which is the organization that manages state licensure examinations for physical therapy. And then the Academic Council of the American Physical Therapy Association. That concludes this PowerPoint presentation. I'd like to thank the American Physical Therapy Association for providing this PowerPoint as an educational resource for individuals who may be interested in pursuing the PT profession.
All right, welcome to Accellacare. This is kind of the main area in our clinic. If you look over here, we've got a little bit of exercise equipment. So this one's called the Total Gym. Then we have the bike, and we have an arm bike here too. If you come this way, you'll see our body weight supported treadmill system. And so what we can do with this is we can get you strapped up kind of in like a jacket, and we can unweight you a little bit. It makes walking a little bit easier. If you look around here, you got some of our treatment tables. Obviously we have a lot of space here. We need a lot of space when we're treating our patients. All right, we'll come around the corner here. All right, this is our electrical stimulation unit. occasionally we'll hook patients up to it just to get their muscles working with a little electrical stimulation. We got some more treatment tables around here. This is Randy. He's our friend here. We'll use him for our Work Steps program. What we do with that is we'll kind of bring people in and see how well they're able to lift stuff and do different tasks associated with their job. So he's pretty heavy. We'll have people carry him around sometimes. All right, we got our gray mat table here. We'll do different exercises with patients on that as well. All right, and if we look here, this is the AlterG. This is another way that we can get people to walk, kind of with their body weight supported a little bit to make it a little bit easier. It's pretty cool. It fills up with air, and by filling up with air, it's able to take some of the person's body weight off. So cool stuff there. Here's some of our weights that we use. When we're working with patients, sometimes we really need to load them to get them stronger. You can see we've got a couple dumbbells there and a couple kettlebells. All right, we'll look over here. We've got our mirror here. Sometimes we'll have patients do exercises by the mirror so they can kind of see what they're working on, make sure their form looks good. Got a couple more treatments back here. We've got a sled right here. We'll load this sled up and we'll have patients push it. It's just another way to get patients stronger when we're working with them. And then we have another total gym machine back here as well. So that's the clinic.
Hi, my name is Damien, and I'm another doctor of physical therapy student here at Excelicare doing my observation. One thing that most people also don't realize about physical therapy is that we're also trained and certified in doing manipulations. Am I good?
All right, so one of the cool things that physical therapists get to do is we get to help people get back to doing what they love. So Damien likes to run, so Damien's gonna run a little bit. Another cool thing that we get to do as physical therapists is kind of use our eyes and our hands to figure out what's going on with people. So expensive MRIs and x-rays and stuff aren't always needed. So I'm gonna test Damien's strength here really quick. So Damien, I'll have you bring your shoulder out in front of you, good. I'm gonna push down here, don't let me move you. Good, so he's nice and strong there. We'll come out to the side, push down here, don't let me move you. Good, all right, I'll have you lay down, Damien. All right, now we're just gonna kind of see how his shoulder's moving. So, are you okay here?
Yep.
Okay. Good. All right, so physical therapists also like to use exercise as medicine. So Damien, you can go ahead and do your exercise here. So no pain, no gain is not always the name of the game with physical therapy, and we really try to tailor our exercise programs to fit each patient that we treat. Hey guys, thanks for tuning in to the PT edition of Virtual Journeys and Destinations. I hope you guys learned a lot. Physical therapy is a pretty cool profession. I like it. I like being able to move around and stay pretty active throughout the day, and I like being able to help my patients move better. So, thank you.